Cost of care in the U.S. In 1965, President Lyndon B. Johnson realized healthcare was unaffordable and thus signed a bill called the Social Security Amendments. This led to the creation of a fundamental program tailored for individuals aged 65 and above, as well as another initiative offering health insurance to those with restricted income supported by both state and federal funding. A discussion within the Social Security Administration and Congress regarding the necessity for a social insurance program to furnish reliable health care coverage for older Americans was discussed. Many public hearings were conducted and various proposals were introduced. Around 1960, it became evident that private insurers were unable to deliver comprehensive and affordable health coverage. Medicare expanded again in 2003 and 2006 as they created modernized parts to cover more needs. In 2010, the Affordable Care Act was created to ensure that every person is able to receive health insurance, whether it was public or private. Healthcare costs in the U.S. are among the highest globally, reaching $4.5 trillion in 2022. That is $13,493 per person on average. Comparatively, other prosperous nations' median healthcare expenses per person are just under half as high. Despite higher spending, the U.S. falls short when comparing typical health standards. Adoption of advanced medical technology may enhance standards but also leads to costlier treatments and supplies. Projections from healthcare professionals show that services are insignificant, unproductive, costly, and wasteful account for 25% of all healthcare spending. Eligibility for Medicare at age 67 contributes to rising healthcare costs over time, with projections showing a dramatic increase in Medicare expenses. Medicare also means that the typical price for healthcare is higher for the people enrolled than it is for anybody else. There are a few solutions to the issues of cost in the U.S. which are listed below. System-wide changes for cost control. System-wide changes to delivery and payment structure hold the greatest potential for slowing the rate of rising expenses and maintaining healthcare quality and access without merely shifting cost around. Importance of higher quality care at reduced cost. Modifying the way federal programs finance healthcare in order to incentivize providers to provide higher quality care, cut back on wasteful spending and services, all of which allow healthcare to run more smoothly. These choices include the implementation of pay-for-performance programs, the use of capitated payments to Medicaid long-term care users, and alternative patient care payment models such as bundled payments and accountable care organizations. Increasing beneficiary awareness. Increased awareness of healthcare costs helps motivate beneficiaries to participate more in the decision-making process. An example of this would be co-payments and deductibles that can be structured to increase patient cost awareness. Reducing government healthcare funding involvement. To keep the services available, there needs to be less involvement regarding government healthcare funding, which also limits federal spending. Options for Medicare include raising the age of eligibility, raising premiums, or boosting taxes on benefits. All of these actions would lower the amount of financial aid given to beneficiaries with higher incomes. And reducing federal expenditures. Among the radical redesigns of federal healthcare programs that these choices entail are fusing Medicare's Part A inpatient care program with Part B ambulatory services, which redefines healthcare for low-income people who qualify for both. Transforming Medicaid into state block grants and Medicare into a premium support scheme that would enable recipients to buy insurance through health insurance markets. The agency we chose was the Center for Medicare and Medicaid Services. They have different programs such as Medicare, Medicaid, and Children's Health Insurance. Their goal is to research and develop payment plans and insurances to lower the expenses of healthcare to the community. They are also able to create models and try to predict the trend in the future. Our leader is Chiquita Brooks LaShore. She is the American healthcare official at CMS. Brooks serves as an administrator for the Centers for Medicare and Medicaid Services. Brooks also agrees that the price of Medicare in the United States has grown exponentially. She's a former policy official who played a key role in guiding the Affordable Care Act through the passage and implementation. She has decades of experience in the federal government, on Capitol Hill, and in the private sector. As Deputy Director for Policy at the Centers for Consumer Information and Insurance, oversight within the Centers for Medicare and Medicaid Services, and earlier at the Department of Health and Human Services as Director of Coverage Policy, Brooks LaShore led the agency's implementation of ACA coverage and insurance reform policy provisions. In an effort to reduce the cost, Brooks has proposed a new act for 2024 that would allow the prices of pharmaceutical drugs to be negotiated. This would prove beneficial as many in the U.S. are already paying high prices for over the counter drugs. In addition to lowering the cost of pharmaceutical drugs, Brooks is also trying to lower the cost of healthcare as a whole. In partnership with the Biden healthcare administration, Brooks is ensuring that those who filed for unemployment in 2021 due to COVID 19 can receive healthcare at a lowered cost. Not only will the cost of healthcare be lowered for those who filed for unemployment, but some may even qualify for free visits to the doctor and even reduced price of prescription drugs. Some strengths and quality that she has. Experience and knowledge. Brooks LaSure has held numerous important positions in the public and commercial sectors, bringing a lot of experience and knowledge to the table. Her vast experience has given her a thorough understanding of health administration and policy. Her varied career path makes her an accomplished leader with insightful knowledge of the nuances of the healthcare industry. Vision and innovation. Brooks LaSure is a leader who is distinguished by her creative thinking and visionary attitude. She has continuously shown that she is capable of approaching challenging healthcare problems in a novel and innovative way. She is positioned as a leader with the ability to strategically and creatively navigate the changing healthcare difficulties because of her visionary approach. Collaborative leadership style. In order to successfully navigate the complexities of healthcare policy, Brooks LaSure is renowned for her capacity to work with stakeholders from a variety of sectors. She does this by establishing partnerships and consensus building. The hallmarks of Brooks LaSure leadership style are cooperation and teamwork. Acknowledging the intricacies entailed in healthcare policy, she is well known for her ability to collaborate proficiently with stakeholders from other fields. She creates an atmosphere that is favorable to tackling the complex issues in the healthcare policy by forming alliances and reaching consensus. Advocacy for equality. She is a leader who places a high priority on social justice in healthcare policy because of her dedication to achieving health equality and addressing gaps in healthcare outcomes and access. Some traits that she needs to improve on. Communication. Effective leadership requires effective communication, and while Brooks LaSure shows a remarkable grasp of healthcare policy, there is room for improvement in her ability to communicate her goals and tactics to a larger audience. This includes decision makers, members of the public, and different stakeholders. Improving her communication abilities will help her projects have a bigger impact and encourage more understanding and support. Navigating political dynamics. Political issues are intrinsically linked to healthcare policy, and successfully managing these dynamics calls for a sophisticated strategy. In an atmosphere where competing interests are common, Brooks LaSure's work necessitates a solid understanding of political strategy and diplomacy in order to successfully argue for her ideals. Gaining these abilities will enable her to handle political complexity with greater effectiveness. Adaptability. Effective leadership is fundamentally based on adaptability, particularly in the dynamic field of healthcare policy. The leadership of Brooks LaSure stands to gain from improved capacity to quickly adjust to novel situations and obstacles. This ability is essential for maintaining long-term objectives in the face of the ever-changing healthcare and policy context. Strategies for improvement. Communication training. Investing in communication training and media coaching can help Brooks LaSure refine her message and enhance her ability to effectively communicate complex healthcare policy issues to diverse audiences. Political savvy development. Building relationships across party lines, honing negotiation skills, and gaining a deeper understanding of the political landscape can empower Brooks LaSure to navigate political challenges more adeptly and advance her policy agenda effectively. Continuous learning and adaptation. Engaging in continuous learning, staying abreast of emerging trends and best practices in healthcare policy, and fostering a culture of innovation within her organization can help Brooks LaSure stay adaptable and responsive to evolving challenges and opportunities in the healthcare landscape. These insights provide a starting point for understanding Chiquita Brooks LaSure's leadership style and areas for potential growth. Further research and analysis can provide more detailed insights into her leadership effectiveness and potential strategies for improvement.